Okay, so let's look at the second type of intracranial hemorrhage, which is subdural haematoma. And here we see a CT image of a subdural haematoma here. Now the mechanism for this is also a head injury, but in contrast to the extradural haematoma, it's not something that happens straight away, or it can be, but sometimes it is from a head injury that can be several weeks old. The head injury may be relatively trivial as opposed to a substantial impact seen of the extradural haematoma. And with the extradural, we saw a hyperdense collection of blood, but in subdural haematoma, there may be a hypodense collection or a hyperdense collection, depending on whether it's an acute or a chronic subdural haematoma. And I shall point this out in another CT head in a moment. Here we can see a hyperdense bleed, so this is an acute subdural haematoma. The bleed crosses skull sutures. Okay, so there'll be sutures where the temporal is meeting the parietal, where it's meeting the temporal is meeting the greater wing of the sphenoid, and so on. Extradural haematomas don't cross those boundaries, but do you notice here the bleed goes all the way across, crossing suture boundaries. This is a characteristic of a subdural haematoma. Also, the bleed extends along dural reflections. And look what you see here. This is part of the falx cerebri, okay, and you can see this hyperdensity tracking along the falx cerebri there, okay. So crossing suture lines, reflecting up dural reflections, and it's crescent shaped or sickle shaped as opposed to lentiform. Now the bleeding from a subdural haematoma is typically venous, and it comes from bridging veins, which I shall show you what they are in a moment. Now the way this patient may present can be quite insidious, really. So you may have an elderly person presented with an altered mental state, difficulty with walking, with headache, with confusion. Now with those set of symptoms, it could be many things. Even a UTI could potentially present in much that way. So if you are seeing an elderly person in the emergency department with these symptoms, always ask, have you had a head injury in recent weeks? So here is an image of the brain. Here we can see the parenchyma of the brain. Here this SS is the sagittal sinus, or really the superior sagittal sinus, and here we can see a bridging vein which drains the parenchyma directly into the superior sagittal sinus there. And in this image we can see this here is the dura. An area of dura has been incised and reflected upwards. Here underneath, under the dura, we can look down at the into the subarachnoid space, and the pia and the pia mater and the brain underneath, and we can see one of these bridging veins which is coming up to drain into one of the dural sinuses within the two folds of the dura mater. So when somebody hits their head, their brain shakes within the head, within the skull, backwards and forwards, but these veins are tethered here into the dura, and these may shear and break and then bleed into the subdural space, which you're looking at here.